Hello, everybody. A successful hair transplant does not begin in the operating room. It begins with the diagnosis, a strategy, and a long-term vision. This is your hair restoration master plan, and let me explain you how we do it. So, I'm going to show you a few photos, and you will see how all this is created at detail. I'm going to show you here. This is the first time that this patient come to us. What we're going to do is we're going to check with the dermatoscope, and we're going to evaluate the entire scalp. We want to see if there's any redness, any thinning process, what are the things that we need to do. And that's the day previous of the surgery. Now, when we check the scalp at the more detail, what we see during the dermatoscopic evaluation is this. We're going to see at the closer view how the hair grows. And the hair grows in families. As you can see here, there are bunches of families. This is 1, 2, 3, 4 follicles or hairs per graft. This is 1, 2, 3. This is a family of 2. This is a family of 1, single one here. Okay, here are 2. So there's bunches, as you can see. This family, the right name is graft, because there's a lot of confusion between a graft and a follicle or hair. Follicle and hair is the same thing, but graft is a total different thing. Graft is the family, okay? Graft is the family. So if we're gonna see it at the closer view, we will see with short hair, you can see the bundles, okay? The graft, okay? Made of 1, 2, 3, 4 follicles per graft. Now, when we see this at the closer view, so we see that this is the graft surrounded by normal skin, another family of graft around skin, and this is 4, this is 3, this is 2, this is 3, this is 3, and this is 1. So all this is when we do FUE, that stands for follicular unit excision, we decided which families are going to be the strongest one, the best ones. And here we can choose in FUE, if I'm going to create density, I need a lot of big grafts. If I'm going to do a frontal hairline, I will need a lot of singles to create 100% natural result. So what we're going to do now is that I'm going to pick this. I will extract this using the finest, the tiniest, the finest punches in the market in order not to eliminate skin. We don't remove skin. We remove the graft. And if the doctor has a lot of experience, they will use the smaller, the finest punches in the market. If the doctor doesn't have experience, then they're going to pick big punches to extract the follicular unit. This is very important because in order that you choose the finest one, we are not going to leave scars in the donor area. If we don't have experience, it's a doctor or uses the robot, I'm so sorry, but the robot uses 1.2 to 1.4 millimeter punch. We use 0.7 to maximum 0.9, less than a millimeter. So the extraction is half of the size that the robot. So most of the time, the doctors that they don't know how to do hair restoration manually or with machines, they pick the robot, but that will be a topic for another time. But at least the size of the punch is double that the size that we use actually. Now, we can pick this one, then we leave these ones. I pick this one and I leave, and then I extract randomly. picking the best ones, the strongest ones, depending where am I going to transplant. The frontal hairline, the central area, the frontal, all the front, the mid scalp, or the crown, okay? Now, when we look at these families, what you see below the skin, once we extract already the follicular unit of the graft, is this. This is what we have at the bottom. You can see these tiny balls. These are the root of the hair. This is the follicle. And these follicles are the ones that we need to extract the whole thing with the sebaceous gland and everything in order to make it grow. Sometimes the patient says, but I have certain number of grafts but didn't grow. That means that probably they cut only the surface and they leave behind the roots. Of course, if you are, let's say you are moving one plant to another, you wanted the plant to grow in another place, but you only cut the leaf, so you leave the root, it's not gonna grow. The same thing here. So we need to extract in a very delicate way each one of them, selecting the strongest ones, okay? So that's why the hair transplant, it is permanent, yes. It has lifetime result, yes. But we need to carefully select each one in order to choose the right ones depending on what we're going to do. Now, this is like a diagram that you can see. This is the follicular unit of a family of 3 follicles in the sebaceous gland, okay, the sweat gland, and this is the muscle that attach and to keep still the follicular unit. So now, when we want to extract, as I said, we need to remove the entire follicular unit, okay? Now, this is like a family of a graft of 1 follicle, a graft of 2 follicles, you can see 2, a 3 follicle graft, 1, 2, 3, a 4 follicles per graft, 5 follicles per graft. And this is why sometimes there's a few doctors that they discuss in terms of follicles. That's not the right way. We discuss in terms of follicular unit or graft, because at the end, yes, we give you an account of how many follicular units you have, because there are some patients that they have a lot of 3s, a lot of 2s, or per donor area will give us a lot of 1s and 2s. If the patient already had previous surgeries, most of the time, unfortunately, I do a lot of reconstruction once a week at least, and they leave me what is like the singles and 2 hair grafts because they focus on the big grafts and they wasted, they didn't grow, the patient needs another surgery. So that's why it is so important. The first surgery, especially the first surgery, it's the most important one because the scalp is a virgin scalp, doesn't have any fibrosis. That is very important. But most importantly, if this is going to be your second or third or fourth procedure, then we really, really need to pay attention of what we are going to do, because you have a donor area that is not unlimited. That donor area is going to have a certain number of grafts that depends on the density of the patient, how many safe donor area, how much safe donor area the patient is going to have. So I'm going to show you a few examples of what we do. And so this patient needed temporary resections, okay? So look how fine, how beautiful is this, okay? This is how the irregular pattern that Dr. Ron Shapiro, my beloved teacher, one of my teachers, teach me how to do it. And the hair transplant needed to look with 100% with a natural look. So if you notice a hair transplant on the street, that means that is not a very good one, because the good transplant that unfortunately those are the ones that give us bad reputation because some people didn't study enough and did the bad work, so make it look like doll's hair. We're gonna discuss that later, but just to start with one of the most common things that we do. Now, what is one of the things that we take in consideration when we're deciding how many grafts are we going to place? Depending how much density we want to create, depending how thick the hair of the patient is, and depending on the donor area. Of course, we need to see what is the size of the recipient area, that we have enough grafts in the donor area in order to move hair from here to the top. Now, in this patient, one session, very nice result, even though the patient has very fine hair. So when we have fine hair, we need to put it very close to each other in order to give us the volume. When the patient has a lot of thick hair, then we can place less grafts in the same size area because the patient has thick hair. So will give us, with less graft, will give us more volume. This patient also is a patient coming from San Francisco, and this is like something that we did it with a beautiful, beautiful result. And you can see here how we create all these with grafts with good, very good density. This is another patient with the result. This is another patient, single session. Actually, this patient was one of the toughest, I would say my number one toughest patient, because he has a lot of surgeries before for other causes, and it was a lot of fibrosis. So we did this, we camouflaged the scars that he used to have, and beautiful result. Now, this patient is a patient coming from Washington, and with a single session, very thick hair, okay? So we can do amazing things. This is a very difficult case because we needed to camouflage some scars because he had after a motorcycle accident, but also look at the size of the area to be transplanted. And the donor area was not very good. But we started a regenerative therapy and the hair restoration, and at the end of the result, totally different with the after. Now, let me put you more light. I don't know if you can see better now. Now, this patient, single result, one surgery, very thick hair, a lot of density. And we create this, and the final result will be at 14 months. But we can see here at 9 months after the FUE, ta-da! Okay, of course, my patient is crazy happy. Look at the top. Look at the top. So here, we can see the before and the after, just 6 months after the FUE. Why I put you this photo? For two reasons. I want you to see how the donor area, it looks even better after the surgery. And this is because of the regenerative therapy. The regenerative therapy allows us to also reinforce the donor area and in order not to suffer from the extractions, so that the healing process is crazy fast and the patient will look gorgeous from the top, from the front, and from the back. Another thing is that look at the density, very high density. We specialize in mega sessions with high density. This is something that is really important. And another thing is that we want to move this hair to this, but I don't want the donor area to suffer. Very thick hair, and we can do it in a single session. Now, another thing is that the final result will be at 14 months. But I want you to see that even at 6 months, This patient looks amazing, extraordinary. Now, look at the side. Look at the donor area here, that before the hair transplant, and this is after the hair transplant. This is something that is really important. Look at all the black hair, more than white hair that he used to have. Why? Because of the newest stem cell, dermapapilla stem cells exosomes. So, and that's the regenerative therapy by invasive therapeutics. Now, and look at this density, okay? In just 6 months. This means that you are literally 6 months to look at your very best. So, let me see another one case that we have here. A very young patient that we needed to lower the temporal recessions, density here, mid scalp and crown. Here we have the result. Now, the crown area. The crown area is very important because it's very easy to transplant. The crown area, if you have a very good density, most of the time will require in between 2,500, 3,000 grafts, depending on the thickness of your hair. But it's just one surgery and that's it. Okay? We can do it now with long hair. We don't shave. At the end, you end up like this. Now, another case that we transplant all the front, the mid scalp, and the crown, and we transplanted 6,740 grafts. And this look at this number of hairs and follicles, because as we explained before, the number of grafts is this, and look, more than double the number of follicles, because this patient had a very good donor. You see that the donor area looks intact, okay? And we extracted already more than close to 7,000 grafts to do it with high density in a single session. So, and the donor area didn't suffer. Again, regenerative therapy with hair restoration. Now, this is another partial result, a patient with 8 months after the procedure. We can see here, again, look at the donor area, okay? On the sides, we can see gorgeous donor area, okay? Actually, okay, darker than before, and a lot of density, single session, a single session. Okay, now I'm going to explain to you what are the difference between the photos and the patients that unfortunately we receive almost every single day. I receive photos, videos, patients looking for help because they have this result. This is our result. This is all other clinics' results that we need to fix. Now, not all the time we can fix it, depending if the patient have a donor area, we can. But if the patient doesn't have good donor area or beard or chest or back, sometimes we can do a body hair transplant. So this patient, look, first of all, big grafts over here in the frontal hairline, where we discussed that in the frontal hairline, we never put big grafts, not even 2 follicles per graft. We use singles. We use the finest singles in the front. Then the singles are more thick, and then the 2 hair grafts, and then the 3 hair grafts to create a diffuse effect. Now, this patient with very poor density, as you can see, and this line, look, with big plugs in the front, and also the direction. Pay attention how this hair grows like this. Then here, this hair is growing like this. Then these ones are going over there. So this is something that shouldn't be happening. And this is after. This is what we do. This is what we do. And this is what we fix. Okay? Look at how natural it looks. Look, the big plugs with low density. Now, here, straight line, irregular, with a lot of density. Again, poor density, big plugs, normal. And now the newest technique, the long hair FUE. The patient, this is a patient with a very straight line, big plugs, low density. And this is how gorgeous my patient looks. Now, the patient doesn't need to shave her scalp, or a male patient that has the hair long, and we're going to discuss the different techniques. We don't need to shave, okay? Now, in terms of the techniques, we can do a short hair FUE. If you wear your hair short, you can have a short hair FUE. If another technique is to leave this part long and the donor area short, or long hair everywhere. We don't shave the scalp. We can do long hair FUE. I have the honor to introduce this technique to Mexico and United States in 2018. After learning it in Brazil, the long hair technique burns, and then Dr. Roberto Tibillini perfected his machine to do it. Okay? So this is how we create the master plan, and it is very important. So after seeing all of these transformations, I want you to remember something. These are not just before and after photos. These are real stories, real people, real lives that were changing. So these are people that regained their confidence. They stopped hiding behind a hat, behind a hairstyle, behind a wig. People who start smiling again in the photos. People who finally find themselves. And that is exactly what inspiring us every single day at Baja Hair Center. So anyone can talk about grafts. Anyone can talk about techniques. Anyone can talk about equipments. But very few people truly understand the emotional impact a hair restoration can have in a person's life. That is why every single plan we create is customized. Every hairline is designed individually. Every graft placement has a purpose. Every recommendation is made for your long-term future in mind. So my goal is not only to give you more hair. My goal is to give you the right result, a natural result, a balanced result, a result that looks spectacular, incredible, not only when it grows in, but for many years to come. And as I mentioned at the beginning, my mission is to serve you at a higher level as possible. Be meticulous, be committed to excellence. And I treat every single patient the way I will love a family of my own family to be treated. So if you're considering a hair transplant, I encourage you to do your homework, ask questions, compare options, compare quality to quality. Please understand the differences and choose a team that sees you more than just a procedure. This is not a cosmetic change. This is a personalized evaluation and result Thank you for allowing me to share philosophy or process and my passion. And if you're ready to discuss about what are the options, what are possible, what is possible, it will be a real honor for me to evaluate your case and to create a personalized master plan designed specifically for you.